Are we here? Are we here? Yeah. We're here. We're live. We're live on YouTube. We are live on YouTube. We are live on YouTube. We are live on YouTube. How are you guys doing? We are live on YouTube. We are live on YouTube. My second live ever. It's amazing to be here, guys. I'm excited. I'm excited to be here. This is the second live. We're going to be talking about autoimmune diseases. Autoimmune diseases and how that could lead to several conditions. Yes. How autoimmune disease can lead to several conditions like lupus. Apart from that, we have type 1 diabetes. And apart from that, we have rheumatoid arthritis. Yeah? Yes. So all these diseases are autoimmune diseases. Hello, everyone. Hello. It's good to be here. It's good to be here. It's good to be here. I'm enjoying this space so much. I'm enjoying this space so much. I think my settings is much better today compared to yesterday. You guys let me know what you think. Is it better settings? I think I still have to like do a bit of adaptations, but we're getting better. Ladies and gentlemen, shall we start? Hi Vicky, how you doing? Shall we start? Please share, post on your WhatsApp, post somewhere, get more people here. I see you, Eunice. Akosia Santi, I see you. Deb, I see you. I see the amazing people here. Now let's talk about the immune system and how the immune system can actually go to a place of autoimmune diseases. When we talk about the immune system is what keeps us away from diseases, okay? And so it is extremely important. By the way, who enjoyed yesterday's live? If you enjoyed yesterday's live, say, I enjoyed it. If you enjoyed yesterday's live, say, I enjoyed it yesterday. Yesterday, we talked about how vitamin D deficiency actually impact cancer progression. And it was amazing. It was the first live, but it was very amazing. We got so many people to join, about 50 something averaging. And it was great. Today, I'm excited because we are taking it further. Let me put a bit of Vaseline. Yes. I hate my lips to be dry. We are taking it further. Okay? JD, you fell asleep. Okay. We are taking it further today by talking about how vitamin D deficiency actually is the root cause or one of the root causes of autoimmune diseases like lupus, like type 1 diabetes, like rheumatoid arthritis. Okay, so it's very important that we pay extreme attention. Now, guys, please take your pen and your paper because this is a class. It's a class on YouTube. It's extremely important that we take our pen and our papers and we stay relevant and we stay focused and we learn today. All right? It's just going to be an hour. Just an hour. Not more than that. An hour. We are out of here. Now, I want to teach you a little bit about the immune system. The moment you learn about the immune system, that is much, much easier for you to understand what triggers the immune system to sort of like fight against itself. okay, fight against itself, because the immune system is meant to fight for you. However, in certain circumstances, the immune system can fight against you. It is so crazy that imagine soldiers in a country like America fighting against America itself instead of protecting America. That's exactly what happens. But then it does not just initiate and start a fighting against the body. There are systems, things that happen that makes the body start fighting against the body's soldiers, fight against its own self. Okay? Now let's go there. But before that, let me take you to what an immune system is. Okay? Inside the body, we have what we call immune cells. Now, they fight against pathogens, they fight against disease, they fight against, even chemicals that, we take in our system that are going to harm us. Your immune system clear all those kind of things. There are two types. The first type is what we call innate immune system. Innate means that you are born with it, okay? And that one, you mostly get it from your mother, okay? And then we have what we call adaptive immune system, right? That one, it is based on your environment. So this is, guys, I'm talking as if I'm in a lecture class because this is a lecture. I want you guys to understand very well that whilst we are here, this is teaching, right? We are learning a lot, and then we will use that knowledge to impact our lives. So imagine a mother whose immune system is not good. Guess what? The child's innate immunity is also not going to be good, because innate immune system is something that you are born with. Now, we classify them. So if you look at a baby born today, they will have some level of immunity that they get from their mother. Does it make sense? Yes. Now, we classify them into, so innate immune system would be your macrophages, right? Your monocytes, your dendritic cells. They can all be classified. And don't worry about the name too much. They can be classified as innate immune system. These are what, if I was to take a newborn baby and look at their system, they may have these cells available in them. And then we have the adaptive immune system. Now, the adaptive immune system, as the baby grows, as we are growing, based on our environment, we get to train those immune systems that are going to be fighting real serious pathogen and real serious issues. Now, those are what we call the T cells, the B cells, right? The T cells and the B cells are mostly what we call the adaptive immune systems and natural killer cells. Now, think about this. Just like the heart needs oxygen to pump, the whole body needs oxygen, and they need, every organ of the human body needs certain specific nutrients and things to function properly. Just like the soldiers of every country need the ammunition, they need the food, they need the water, they need to be taken care of properly because they're doing an amazing job. They're doing a very important and paramount job by keeping the country safe. So imagine the soldiers of the country not being taken care of properly. That means that they can give up on that country. Now, if the soldiers of that country give up on that country, guess what? That country becomes vulnerable to other countries invading that country and occupying that country. That is what we call low immunity. That is, immunocompromised person, meaning when you go and do your blood count or your blood works, your full blood count, your white blood cells numbers are going to be low because your immune system is low. Nonetheless, when your immune system is low, that is not what we call that's not what leads to autoimmune diseases. No. A person like that any little bacteria that, any little flu, any little virus can actually, interfere with their immune system and beat the immune system and dampen the effects of the immune system. And so we all know that one person that every single year, when the cold comes, he or she will have will catch the flu before anyone else, or will catch the cold before anyone else, will catch the whatever virus is roaming about before anyone else. That is the person that we call immunocompromised. So a person like that, we say that their immune system is low. And how do you increase the immune system? You increase the immune system by exercising, by taking your vitamin C, lime, lemon, by taking ginger, cloves. All those natural stuff will actually increase your immune system. By so doing, you put yourself in a position where you are not compromised for any pathogen and any disease to invade your system and cause damage. Now, by the way, do you guys know that some bacteria and some viruses can actually cause cancer? So imagine if you're immunocompromised, you are actually also at risk of cancers, because any bacteria or any pathogen, any virus that can come into your body and will betide you, if that bacteria or virus can have carcinogenic effect, then it starts interfering with your actual cells, and then those cells eventually, guess what? Start becoming cancerous. Right? Fantastic. Now let's go to how come your immune system actually start attacking its own self? Its own tissues that is supposed to be protecting, is that attacking them? This is what happens. Imagine, right? These amazing soldiers are doing amazing work, and they are protecting you, making sure. Oh, okay. Guys, please tap on the heart to like the live. This helps really to sort of like boost the recommendation of the live to other people as well, so that they come and learn as well. Now we're learning autoimmune disease. How come the body's immune cells that protects them, supposed to be protecting the tissues, start attacking the tissues themselves? Now imagine I am the soldier. The soldier department, we are doing all the job that we're supposed to do, but then the government, the president of that country, decides that they are not going to give us what we need to do our job properly. They're not going to give us food. They're not going to give us ammunition. They're not going to give us good shelter. They're not going to do all the things that we need to function properly. Now, guess what is going to happen? What is going to happen is that the immune cells, the soldiers, will actually rebel against the government. They will rebel against the authority. They will rebel against the very same country that they were supposed to be protecting. And that is exactly what happens when a person has autoimmune diseases, because the person's immune system, instead of them to get certain nutrients, certain proteins, certain vitamins, certain certain things, molecules, they are not getting these molecules. And so they say, you know what, we are going to go against our planned or programmed function, and we're going to do whatever we like, because this person is not taking care of us. This body is not being fed to us. But then unfortunately, that is when autoimmune diseases actually start. Now, how do we prevent autoimmune diseases? Now, before that, let's go to an example of autoimmune diseases. We know that type 1 diabetes is an autoimmune disease because guess what? Thank you so much. You're really educating us, and we are grateful. Man, it's my pleasure. I love teaching. It's my pleasure. It is my pleasure. So imagine a person that is not eating healthily, is not sleeping well. How do you get your immune system to be against you? Don't eat healthy. Don't sleep well. Don't take your vitamin D or take your vitamins. Don't take your iron. And then that is how you actually trigger your immune system to be against you. Why? Because they need these structures to function properly. An example of autoimmune diseases is lupus. Lupus is an autoimmune disease where your immune system actually, due to inflammation, when you have an elevated level of inflammation. Now, again, guys, let me break it down to you. Inflammation is not bad. A lot of people hear inflammation and they think, oh my God, inflammation is bad. Inflammation is bad. I don't want inflammation. Thank God you have inflammation, because inflammation, without that, no issue can be solved in your body. No bacterial invasion, no viral invasion in your system could have actually been able to be resolved. However, because of inflammation, because your immune system can respond to certain changes or certain invasion of bacteria and viruses, it can respond to those and they produce aggressive, it's like ammunition. They start fighting them, and that is what is inflammation. And so inflammation is good provided it is a short period of time. The moment it becomes a long period of time, that's what we call chronic. So acute, short period; chronic is long term. We don't want the chronic, because the chronic can actually have very serious side effects. We want it acute so that the immune system will start firing ammunition, kill whatever bacteria, kill whatever virus, and then we can have resolution. And then after maybe like a week or two, we are fine, and then back to regular schedule. But the moment your immune system is now malfunction and they cannot kill the bacteria because of low immunity, or immune system not functioning properly because they lack certain nutrients, it is going to be prolonged, because they're not going to give up. Even if the bacteria is winning, they're not going to give up, or the virus is winning, or whatever the pathogen is winning, they're not going to give up. And so they're going to keep on trying to fight. Now, the more you engage in a fight, the more casualties you have. Think about it. It is just like war. War happens in the body, and war happens like the same principle, the same ideology. If you engage in war for a long period of time, there are going to be more casualties, and the casualties in this case are going to be more organ and tissues, different tissues from different organs getting damaged as a result of the war that is happening inside your body. And so inflammation can be metaphorically be described as having a war going on. Because your immune system, which is the innate, which is host to your body, trying to protect your body, is fighting against bacteria, virus, chemicals that are outside of it, trying to get rid of your body. And as a defense, is gonna put on a fight. Is this making sense? Is this making sense? Is this making sense? Is this making sense? Guys, help me. Help me. Let's interact. Help me. Great. Fantastic. Fantastic. So, this is what happens. When you have an autoimmune disease, this is what happens. Beautiful immune system supposed to be protecting you. But because you've decided not to eat healthy, not to give them what they need, now, for some bizarre reason, they do not recognize your own tissues. They do not recognize your own tissues. So it's like going to your house, having a key. This is the same key that you use to open the door. This is the same key that you use to open the door. Now, unfortunately, you put the key in, you try to turn the key to open the door. The key is not being recognized anymore. Yeah? You turn, it's not turning. 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 Because it's not recognizing, and out of nowhere, it's not recognizing. That's what you would think. But it's not really out of nowhere, it's not recognizing. Maybe it's because for a long period of time, you have actually ruined the teeth of the key, right? So you know that as time is going on for the past 2-3 years, you've been using the same key, trying to open, and it opens and it opens and it opens, and you see the key, the teeth is getting is weaning out. Is the teeth are wear and tear is coming to the teeth of the key, and you decided, oh, every time it's like, I'm busy, I'm gonna do it later. I'm busy, I'm gonna do it later. The very night that you needed is cold outside and every shop is closed for you to make a new key. You came home around 9 p.m. You put the key and they try to open it, and then the door is like, I'm not gonna open. And you're like, oh my God, what is happening? Like, this is new. No, this is not new. You've seen very well that the key is losing its grip in the door. It just gave up on you on that very night. Not that it is new. Not that it happened out of nowhere. That is exactly what happens with our autoimmune diseases. Because as they are roaming about, for the lack of you sleeping, so much stress and sort of like that, they do not recognize your cells anymore. So every human cell has what we call major histocompatibility complex, right? And they have certain proteins that are on the surface of the tissue. So on the surface of the tissue, when the immune system is passing by, it will be able to recognize that, oh, this is host. I'm not going to attack it. Oh, I can't recognize this host. I can't recognize this molecule. So what molecule is this? If I cannot recognize the molecule, then it means that it is not from us. So unfortunately, your immune cells are not being able to recognize the proteins and the molecules on the outside of the tissues that they used to now before recognize and they used to protect. Now they come and say, who are you? We don't know this molecule. If we don't know this molecule, by definition, we have to attack you because then you are not part of us. By definition, if we cannot recognize you because that's how we've been trained, then you're not part of us. Then we have to attack you. It is more likely when there is a stranger in your town, you recognize there is a stranger. Exactly. So then, the very same tissues that your immune cells used to protect, now they will start attacking those tissues. So then lupus will be the whole body. It will be in your heart, it will be in your skin, it will be like your organs, all your organs will be attacked by your immune system until and unless you give something like steroids to sort of like decrease the hyper-responsiveness of your immune system. You're not going to be able to. You're not going to be able to decrease the activity of the immune system. Now, guess what? However, lupus, although there is a genetic factor to it, you would have to trigger it. So if you trigger the lupus by the things I've told you about, by the environmental factors, then it's going to be tough for you. Now, guess what? You can actually get the symptoms to be lowered by, of course, doing the opposite of what you did to get it there in the first place. We lost a family member to lupus about 5 years ago. Oh, I'm so sorry. Yes, it makes your body feel funny. So when your immune cells start attacking itself, you have to go on anti-inflammatory diet, which means you have to do things that are not going to increase your level of inflammation, which also means that you need to be eating foods that are low on carbohydrates. I am not a fan of cutting carbohydrate or completely because carbohydrates are there for a reason. But I'm a fan of when you have inflammation going on, you try your best to avoid the inflammation in the first place by decreasing your carbohydrate intake, because carbohydrate would increase insulin, and insulin would therefore lead to resistance. And the more you have resistance, the more you are going to have the symptoms of the autoimmune diseases spike. Yeah. Now let's go to type 1 diabetes, which is also another form of autoimmune diseases. Now this one, your immune cells, guess what? They are attacking the pancreas, the beta cells of Langerhans. And that doesn't allow them to produce the insulin. Or even if the insulin is produced, they attack the insulin that is in the bloodstream, therefore decreasing the ability of the insulin to open the door for the glucose to go in. Yeah? It is extremely important. Extremely important. And this is also, of course, type 1 diabetes has a genetic factor to it. However, if you have any autoimmune disease in your family, you need to check your lifestyle. It is mostly due to lifestyle that will trigger it. Like I say all the time, the fact that you have a genetic predisposition for something doesn't mean that you're going to get that thing. The only issue is that you do not have the knowledge and understanding to go on that lifestyle until the lifestyle of the disease that you have, the if you have hypertension in your family, you go on anti-hypertensive lifestyle. If you have lupus, you go on anti-lupus lifestyle. If you have diabetes, anti-diabetic lifestyle. And that is how you prevent the gene from being switched on. Because I may have a light in my house. However, if the light is not switched on, trust me, I'm never going to have any issue. I know the light is there, and if I switch it on, the room will be illuminated. However, I can decide to switch it on or switch it off and be in the dark. So I have the power. But the only problem is that when it comes to us, a lot of our family members, we do not even know what diseases actually killed them. We don't even know the medical history of a lot of our parents. And that's the problem. And what you don't know, you cannot fight. What you don't know, you cannot even fix. What you don't know, you cannot deal with. And it's going to be an impossible battle for you to fight. Because imagine, by the time you realize that there's hypertension in your family, guess what? You would have triggered it. Because your mother or your father never told you. Because of the fact that they think that you're too young, but they should have put you on that anti-disease that they have lifestyle. Yes. Yes. So you see, Nashomi, what you should have done is the fact that you have type 2 diabetes in your family. You should have gone on anti-type 2 diabetes lifestyle straight away. But you did not know, of course. You probably got to learn it when it was too late. Guys, let's keep on tapping on the like when it was too late. Now let's look at the rheumatoid arthritis. Guys, it's the same similar condition. When it comes to autoimmune diseases, it's the same sort of like, but the only thing is that the immune system are actually attacking different parts of the body. Yeah? They're attacking different parts of the body. And this part, they're attacking the cartilages and your joints. And so when they attack the joints and they are basically like interfering with your cartilage, then you're gonna have you're gonna have friction. Your bones are gonna basically be touching against each other, and then when you have friction, that is when you basically then have the bones fighting against each other and causing a lot of friction, and then the pain mostly originates from there. Can kidney transplant patient take E3, K2? Yes, you can, but you need to be on a high dose, and you need to also be monitored by a doctor. It is very important that you get monitored by a doctor over your period, the initial stages where you're taking the vitamin D3, K2, and then once you're tolerating the D3, K2, then you can actually like also not necessarily see or be monitored all the time, but at the very beginning, it is very necessary. Guys, are we clear? Please keep tapping. Are we clear? Are we clear? Do you have any question? Do you guys have any question about what I've explained? That is autoimmune diseases explained. Any question? Then I'll tell you what is the link with vitamin D deficiency and low immunity, and apart from that, how vitamin D levels actually help with lupus, arthritis, and type 1 diabetes. Vitamin D actually helps your immune cells function properly, and it basically gets them to be sensitive now to recognize your actual human tissue and not to attack them. Now, like I said earlier on, vitamin D is one of the most important regulators of the immune system by releasing chemicals, chemokines, I will call them, like your IL-6, your IL-8. These are very, very, very important. And like IL-15. So the moment you go on vitamin D, you start regulating your immune system. Your body will basically, your immune system will going to be more sensitive to the tissues of your own body and not start fighting them as if they were not part of it. Are we clear? Are we clear? So if you have any question, please ask. If you have any question, please ask. But other than that, I think I have pain and inflammation. Oh, okay. Please keep that. Pain and inflammation. How does pain come with inflammation? Okay. So the reason why you feel pain, when you have inflammation is because there are 5 cardinal symptoms when there's inflammation going on. Sorry, guys. The first one is pain. Number 2, when there is a swell. Number 3, when your skin color changes. Number 4, loss of function. Yeah. And then number 5, heat. So these are very important for you to recognize inflammation. Now, unfortunately, on a black skin, redness is not necessarily applicable, right? Unless the person is lighter. But on a dark skinned man, redness is not necessarily applicable because, if there's inflammation, how is this color going to be like red? It's not possible, right? So this is what is going to happen. When there is a swell because of inflammation, and sometimes, not sometimes, not all the time swelling happens, but when you have inflammation in your body swells up. Are you guys following? The body swells up, and as the body swells up, it is also going to squeeze and put pressure on your nerves because every tissue of the human body has nerves. The moment the nerves are being pressed and being pushed and being squeezed, those nerves are what actually transmit pain to your brain, your thalamus. And then your thalamus will basically, the relay center will tell your brain that, hey, this person has something going on, inflammation is going on. And then the pain will be translated, and then you will feel the pain. And you know what is interesting? The brain itself doesn't feel pain. It only translates the pain. So the pain does not feel your pain. The brain does not feel your pain. It just translates your pain. Yeah, so let's go to how we can reduce inflammation in the body. Like I said earlier on, please make sure that you're drinking enough water. Hydrate yourself. right? So then the hydration basically flushes out any residuals. If your body is fighting any bacteria or any virus or any sort of like issue, it will flush out the pathogens. It will flush out the chemicals out of your system. So drink a lot of water. Yeah, drink a lot of water. Guys, keep tapping, please. It's like you stop tapping. Keep tapping the heart. Number 2, make sure that you're eating healthy. Eating healthy is very, very important. And if you didn't eating healthy, I would say that make sure that you're taking your vitamin D3, K2, and magnesium glycinate daily. Even if you're not eating anything, or if you're not like trying to live healthy, for those 2 supplements or vitamins, you need to be getting them daily. And then you have sleep. A good quality sleep basically regulates your own body and it regulates your circadian rhythm. The moment your circadian rhythm is regulated, I can tell you for a fact that you're going to have longevity. Yeah, because that is how you basically live longer. Yeah. So the person asking, how do we reduce inflammation? That is exactly what. But also, eating healthy can be very subjective, right? So make sure you do your greens. Make sure you're doing like smoothies, strawberries, bananas, avocados, blueberries, strawberries, all the good berries. All the good berries. Is 8 glasses of water a day mandatory? Yes, but make sure that that water is a well hydrating water. If it's not hydrating, then you're going to have an issue, actually. If the water is not hydrating, you're going to have an issue. So it's very important. And we talked about how water does not hydrate. You probably need an electrolyte or Himalayan salt, a pinch of it, put it inside inside the water, and then you're ready to go. And you will see that you'll be more hydrated compared to when you used to drink just pure water. Yeah? Any more questions? Any more questions, guys? Any more questions? So today we treated autoimmune diseases. What topic do you guys want to treat tomorrow? I'm going to give you the freedom. What topic do you want to treat tomorrow? What topic do you guys want me to treat tomorrow? It doesn't matter. Just pick a topic. What is the difference between type 1 and type 2 diabetes? Type 1 is basically your body is not producing the insulin at all because your immune cells are attacking the pancreas and the beta cells of Langerhans, or that your body is attacking the insulin even if they are being made. But then type 2 is your body makes them all right, but your body does not respond to them. Yeah? And then we have gestational diabetes as well, which is type 3 diabetes. Now let's look at, is spring water considered hydrating water? No. Hydrating water is, spring water. I think so. But please, a pinch of Himalayan salt is also still very needed. Very, very needed. Or if you can just take, electrolyte water. So somebody is asking tomorrow to do fibroids and endometriosis fibroids and PCOS. Okay, endometriosis fibroids and PCOS. That's fine. I'm going to do that. And then I'll do, with fibroids and PCOS and endometriosis, you can also have infertility in both men and women. You can also have fibroid miscarriage. So that sounds good. Hair loss, carb, and thinning in 30s, 40s. Okay, good. I think I have some great suggestions here. Let me take a screenshot. I think I have some great suggestions here. Yeah. So, yeah. Did you say we should add to our water before drinking? I didn't get that. Thanks. Just a pinch of Himalayan salt, a pinch, very tiny, just a little sprinkle of Himalayan salt on your water. That would be really good. Hair loss, especially in women. Okay, I'm gonna be doing all that. But yeah, guys, it's 2045. Autism. Okay. Actually, the autism one is very interesting. Actually, I might have to do the autism one tomorrow. The autism one is very, very interesting. So, guys, without wasting too much time, it's been real. I just came here to teach autoimmune diseases, and I hope you've actually learned something from it. Was it good? Was it good? Yes, no. Was it good? Was it good? Was it good? Did you guys enjoy it? Yes or no? Himalayan salt, yeah. Did you guys enjoy it? It was great, fantastic. Okay. So tomorrow it's either fibroids, PCOS, endometriosis, or we're gonna do autism. I've not decided yet, but yeah. Thank you so much, guys. I really appreciate it. You guys are amazing. I hope you've learned something. Very, very soon, when we go on live, I'll be asking all the people that came to TikTok about what they learned about autoimmune diseases, and if you are able to, yeah, guys, share it to a brother, share it to a friend. I'm gonna leave this on there as well, so people can rewatch it. Yeah, people can rewatch it. Sleep apnea. What is the cause of it? When you add on a lot of weight, you can trigger it, but also, of course, it's also genetics as well. So it's extremely important that you know that. Yeah, I'm actually really tired. Yeah, so guys, it's been real. I will see you guys tomorrow. Tomorrow we are going to be talking about either fibroids or autism, and then it's gonna be amazing. So I will see you soon. I'll leave this on there so you can go back and rewatch. All right, fantastic. See you soon.